I'm Dr. Sarah Korn, and I am a surgical oncologist and general surgeon with Wichita Surgical Specialists. What I really love about being a surgical oncologist is that I get to see patients through the entire journey. They come to me initially with this diagnosis and they're absolutely terrified about it. Then I get to spend this time communicating, explaining what's going on, and then taking them through surgery and finally onto recovery. When we get to that surveillance stage of things and people are doing well, that's the biggest reward you can ask for. While I was in surgery residency here in Wichita, my dad found a lump in his thigh during my 4th year of training. That underwent some investigation and ultimately he was diagnosed with Leiomyosarcoma, which is a rare type of cancer. That was my first experience really dealing with the medical system on the patient side, and that was a really eye-opening experience for me. Going through that process really changed the way I thought about how we communicate with patients and made me want to get involved in that process. At the same time, I was able to do a surgical oncology elective as part of residency, and I really enjoyed doing the surgeries as well. When I put those two together, I couldn't come up with a better career than surgical oncology. I specialize mostly in surgical oncology. That's my main focus, and that includes cancers really all over the abdomen primarily. I also do breast surgery as well as skin cancers, and I also do general surgery as well. During my practice, I really strive to develop relationships with my patients. We spend a lot of time communicating and making sure all their questions are answered. Helping patients make the decision to have surgery is a pretty big deal. When you're signed up for surgery, it's by default something scary. It's so far outside of your norm, and when you add a cancer diagnosis on top of it, it gets terrifying. I am careful to spend so much time with patients, making sure they understand what's going on, really explaining not only the risks and benefits of surgery, but what happens if they don't have surgery, what can they expect long-term down the road, and any question they can come up with related to their diagnosis or their surgery. Outside of medicine, my most unique hobby would be woodworking. It's a little dicey for a surgeon to enjoy woodworking, but I'm always very careful with my saws. There's something about being able to make something beautiful and the puzzle of figuring out how to put something together that I really enjoy. I also like spending a lot of time outdoors. I have a garden, I have 2 giant dogs that I like to play with, and then I have many nieces and nephews that are always a great joy to be around.